Her Excellency, our host, Senator 𝐿 𝐶𝐞𝐫, the First Lady of the Federal Republic of Nigeria, my dear sister, Her Excellency Mrs. Amina Adedan, the First Lady of Turkey, my mommy, Her Excellency, my dear sister Fatmata Barbaro, First Lady of the Republic of the Gambia, Mr. Rafah Murano Gorsi, the Director General of the Atomic Energy Agency, the Right Honorable Speaker of the Federal Republic of Nigeria, Tajuddin Abbas, His Excellency Barrister 𝐸𝐻𝐴, the Honorable Minister of the Federal Capital Territory of Abuja, the Honorable Minister of State for Health, Dr. Tunji Alausa, heads of delegations, members of the Fourth Estate, a very good morning to you all. First, let me start by congratulating our host, the First Lady of Nigeria, for putting together such a wonderful event and bringing us First Ladies together and also awakening our awareness on the scourge of cancer in our continent, Africa. I want to say thank you so very much, ma'am, for inviting me and my delegation here today. And I'm very humbled to be part of this. Cancer represents a significant public health challenges in the sub-Saharan Africa, impacting numerous regions across the continent. It stands among the top 3 causes of premature deaths, occurring between 30 and 60 years of age in nearly all of Africa's nations. Globally, projections indicate that both the incidence and mortality rate of cancer will continue to rise in sub-Saharan Africa by 2030 if decisive actions is not taken. While cancer-related fatalities are on the rise in low and medium-income countries, high-income countries have been witnessing a steady decline in both the incidence and mortality rate of this disease. This decline is largely attributed to the presence of robust diagnostic and treatment facilities, adequate human resources, and effective follow-up systems. As a continent, it is imperative that we reverse this alarming trend by intensifying our efforts for the well-being of our people. It is important to recognize that a cancer diagnosis not only impacts the patient, but also profoundly affects families, friends, often becoming a source of considerable emotional distress. In 2020, according to the International Agency for Research on Cancer Global Cancer Report, it was estimated that Sierra Leone alone reported 4,708 new cancer cases, with women bearing the disproportionate burden due to the prevalence of breast and cervical cancer. In response to these concerns raised in cancer incidents, our government, led by His Excellency retired Brigadier Julius Madubiyo, embarked on a strategic plan engaging in collaborative efforts with international partners such as the International Atomic Energy Agency, the World Health Organization, Merck Foundation, Gavi, and UNICEF. This initiative focused on capacity building, the development of evidence-based national cancer control policy, and the enactment of the Tobacco and Nicotine Control Act of 2022. Despite this significant impact of cancer on children, current evidence suggests that environmental or exogenous factors play a minor role in pediatric cancer development. However, recognizing the importance of early detection The Ministry of Health has prioritized efforts to raise awareness and improve detection rates. These efforts include radio and TV awareness programs, sponsored work to drive awareness, and comprehensive training program for healthcare workers at various levels of the healthcare system. Furthermore, in 2022, the government introduced the human papillomavirus vaccination program targeting 153,991 girls aged 10 years in school across the nation. This community-focused intervention aimed to reduce vaccine hesitancies through extensive community engagement activities. Over the years, we have also invested in training healthcare providers and implementing screening programs using advanced technologies such as VIA and thermal ablastation, significantly enhancing our capacity for early detection and treatment. The government of Sierra Leone is demonstrating strong political will by spearheading the establishment of a state-of-the-art radiotherapy center. This center will offer optimal treatment options for cancer patients, thereby reducing the need for overseas treatment and easing the burden on affected individuals and their families. We have completed the feasibility studies and infrastructure designs and are now working closely with the IAEA to commence construction of the cancer diagnostic treatment center that our people will use. At this juncture, allow me to also say, from the Office of the First Lady, we have worked with MAP Foundation. We have managed to train about 42 doctors on oncology and the treatment of cancer and palliative care. Through the Office of the First Lady also, we campaign to bring awareness on cancer problems in our country. We help so many cancer patients to travel out to abroad for medical treatment. But our agenda now is to make sure that we have our own medical facility in Sierra Leone where we can treat our people in our own country. I know we're here to bring more awareness. I know we're here to talk about something that is so prevalent and something that Africans don't want to talk about. When you talk about cancer in Africa, we feel like we're talking about something that we should not be discussing. But it is indeed killing our people. It is killing women, it is killing children, and even men. And until and unless we accept the fact that cancer is one of the most dangerous killer disease we have in Africa, and come together and focus on this agenda in bringing the right treatment and the diagnostic centers that we need in Africa, we will be gathering here, and tomorrow we'll go to another African country, and the other time we'll go to an African country and be talking the same language. We need to now take action. Action by Africans, action by ourselves, where we deal with our problems, a problem that affects our people, and a problem that only us can solve it. And I want to commend again the First Lady of Nigeria for bringing us together, and to congratulate the First Lady of Turkey for joining us African First Ladies. Through this, we know we have support all over the place, and knowing that the IAEA head is here also, we also want you to consider us Africans as partners. We might not have all the wealth in the world, but we also know we contribute to the world's success. As Africans, we have to, together with unwavering commitment and collaboration, we have to fight, and together we can combat this scourge of cancer and ensure a healthy future for our countries, our continent, and our continents that have contributed so much to the success of the world. Thank you very much.
Thank you so so important that indeed we have to do inwards to ensure that not just the prevention but also care and treatment is taken care of in country to reduce the cost. Most importantly, we must build capacity even among the medical practitioners themselves so that we all together, putting our hands together and bringing value to the table of preventing and ensuring that treatment is available in Africa. Thank you, Your Excellency. We're moving on quickly. Would now go to the Republic of Ghana.